We have Francisco Medina here with me. Tenemos a Francisco Medina. He comes from San Diego, California, and has a question about access to healthcare. Una pregunta sobre el sistema de salud. Gracias, Francisco.
Very nice to meet you. Thank you for being here.
Of course.
Yo tengo una lesión en una de mis rodillas.
I have an injury in my knee.
Yo trabajo para el Departamento de Defensa y supuestamente tenemos un muy buen seguro médico.
I work for the Department of Defense, and supposedly we have very good healthcare.
Los tiempos para ver a un especialista, sinceramente, son ridículos.
But the time to see a specialist are just simply ridiculous.
Finalmente, después de 2 años de espera, me aprobaron una resonancia el mes pasado.
2 años?
2 años, después de 2
Finally,
años.
after 2 years, I was able to get an MRI.
Pero me dijeron que tenía que esperar más de un mes para empezar mi rehabilitación.
But I had to wait for a month to start rehab.
Entonces tomé la decisión de cruzar a México y en Tijuana encontré un especialista sin necesidad de cita. Llegué al consultorio y en 45 minutos ya me estaban atendiendo y estaba empezando mi rehabilitación.
So I went across the border to Tijuana, Mexico, and in less than 45 minutes, I was already seeing a specialist and having rehab.
Mi pregunta para ustedes, ¿cuál es su plan para mejorar el sistema de salud?
What's your plan to improve the healthcare system?
So, I hope you're feeling better now. I'm sorry it took so long for you to get the support you needed. I firmly and deeply believe that access to health care is a right and should be a right and not just a privilege of those who can afford it or have access to it easily. It should be something that we make accessible to all people. Again, it gets back to my earlier point. It's about the dignity of people and about the importance of doing what we can as leaders to alleviate suffering, right? You know, when I say earlier about what I think is backwards in terms of this thinking that it's a sign of strength to beat people down, part of the backward nature of those kinds of thinking is to suggest that empathy, right, is somehow a weakness. Empathy meaning to have some level of care and concern about the suffering of other people and then do something to lift that up. A lot of the work that I've done over the years, including as vice president now for almost 4 years, has been to address what we need to do to strengthen our healthcare system. Whether it be what we do to strengthen the Affordable Care Act, to make sure more people have coverage, to what we have done, which is we finally have capped the cost of insulin, for example, at $35 a month. I don't know if this is interactive enough. If I can ask anyone, raise your hand if you have a family member with diabetes. Right? And seniors, and Latinos are 70% more likely to be diagnosed with diabetes. And so when we cap the cost of insulin at $35 a month, what that means is it's the story I hear constantly, including recently from a woman here in Las Vegas, which is finally her mother can afford to fill her prescription for insulin instead of trying to make it last for a longer period of time, even though that's going to lead to her health condition worsening. The work we have done has been about capping the cost of prescription medication for seniors at $2,000. My intention as President of the United States is to now make that available not just for seniors, but for everyone. The work that we must do is about understanding healthcare is a right and should not just be a privilege of those who have access to it. Again, this is an election. That's why we're here, because we have an election coming up. There's a big contrast between me and Donald Trump. When he was President of the United States, he and his friends 60 times tried to get rid of the Affordable Care Act. You remember what it was like before the Affordable Care Act. Pre-existing conditions. When an insurance company could deny you access to health care for a pre-existing condition, which could include asthma, your child has asthma, a survivor of breast cancer, diabetes. I mean, some would argue being a woman was a pre-existing condition under that plan. Tried to get rid of it. I urge everyone to look up Project 2025, which is his plan if he is elected president again. Google it. And you'll see the plan that he has that includes getting rid of Medicare, Social Security, and all of those things that are to the benefit of, again, the basic dignity of all people, and in particular, working people. Look, I come from the middle class. My mother was a working woman who raised me and my sister. My mother was able to finally, she saved up to be able to afford to buy a home by the time I was a teenager. I know everyone has ambition, works hard, has aspirations, but doesn't necessarily have all the resources that other people have. Access to healthcare should not be a function of how much money you have in your back pocket. That's how I think about the healthcare system, including what we need to do to make sure that someone like you who has dedicated yourself to our country and your work has access and doesn't have to go to another country to get what you need.
Gracias.
Thank you.
Gracias, Francisco. Thank you, Madam Vice President.